With that being said, let us look into what are the simple measures that can be followed in order to protect ourselves from mucormycosis and to prevent ourselves from mucormycosis. The first and the foremost thing is strict control of hyperglycemia. You know, our country, India, is considered as a world capital of diabetes. So people who have had COVID or recovering from COVID, always remember they tend to have very high blood sugars. Even the patient who were non-diabetic earlier are going to a state of transient diabetic stage when recovering from COVID. So always make sure that you are checking your sugar levels even at your home, especially the diabetics. You maintain a glucometer properly and monitor your sugar levels. And the next important thing is avoid reusing the mask. Yes, the entire medical community is stating this, that masks are not to be reused. And the hypothesis is that the moisture we exhale into the mask contains humidity, and this moisture, it just gets trapped in the inner layer of our mask. And this humid environment is really good for the mucor to grow. And on reusing this mask, once again we start inhaling this mucor into our system. So the surgical mask or even N95 masks are not supposed to be reused, and the cloth masks whichever you are using are to be washed every day and dried every day in a proper sunlight. And right now, because of this COVID situation, we are everyone are quarantining, and many of us are doing gardening, some compost preparation at home, growing our own vegetables. But make sure that you are wearing proper gloves, masks, and you have, if you have a proper garden at your home, make sure that you are wearing good long shoes and long sleeves shirts also along with a mask, because this mucor has a specific affinity to grow in the dead and decaying organic matter, and even in the manure or the compost bins or in the garden soil also. So make sure that you are well covered when you are gardening or preparing your own compost bins. And specifically, we are make sure that you ensure that your bio waste which is present in your home is every day being disposed. It should be disposed on a daily basis, not just placing itself for some compost preparation or something, not at this time specifically. And avoid steam inhalation. This is what we have been stressing for a past couple of days. We have been seeing several mixopathy people stressing more and more on taking steam inhalation. Take steam inhalation to your glory every day. And we have been seeing patients taking steam inhalation more than 3 or 4 times per day, just to avoid themselves from this COVID situation. But always remember that our human bodies is such a good thing that it has given a very good slimy mucosal layer in the nasal cavity, which just washes off all the pathogens whichever enter our nasal cavity. And once you start taking more and more of steam inhalation, you are basically destroying that slimy mucus layer which is present inside. The normal sinus cleansing capacity is lost, and it is becoming more and more dry, and it is making prone for the infections. And also one more thing, the vaporizers which we are using, we just use it, just switch it off, and once again forget about that we are having water in it. And this moist environment which is present in the vaporizers, it's not being allowed to dry, and it is not cleaned properly. And this provides a proper suitable environment for this mucor to grow. And once again, when you start the steam inhalation, this is being inhaled into your body. So please try to avoid excessive steam inhalation, or try to completely avoid steam inhalation. That's what we ENT surgeons are specifically telling you. And avoid self medication, specifically over the counter medications. I've seen several young people just just going through this Google and taking self medication. Overuse or misuse of steroids, misuse of antifungal medications, irrational use of antifungal, antimicrobial, antiparasitic medications are being done. So please put a check for that self medication thing, and stop using over the counter medication. Please consult a physician or your ENT surgeon, or whoever nearby, a good doctor nearby, if you have some symptoms of mucormycosis. And Avoid overuse of zinc and iron supplements, because still a lot of research is going on this, but the previous research states that zinc and iron are really important growth factors for the mucormycosis growth. So, in vitro studies were done in the past, which states that mucor specifically requires zinc and iron for its survival. So, and in the recent times also, most of us have advised to take almost 18 milligrams of elemental zinc for the women and 22 milligrams of elemental zinc for men in order to save ourselves from COVID situation. But right now, with the increased incidence of mucor in our country, we are advising you just to minimize your multivitamin medications and take them only if you have some symptoms which are persisting. And finally, we are asking you to get a vaccine. This is like a marriage thing. There are many memes which are going on. Initially we asked you to get a vaccine, but you were hesitant to take the vaccine. Now we are in a shortage of vaccine, but by God's grace, once again the healthcare system entirely boomed up, and there is a very clear evidence stating that people who have got both the shots of COVID vaccine are really protected with COVID as well as the mucormycosis, as this is an opportunistic infection. So, if given a chance, you just completely get yourself vaccinated, whatever vaccine it is. All the vaccines are equally potent enough, and this definitely helps us from avoiding the third wave itself and protecting ourselves from the third wave. So, with this, the take home message I would advise is first and foremost thing, have strict control of sugar levels. Better to maintain a glucometer, as I mentioned in my earlier slide. Keep a watch on symptoms, whatever I mentioned you earlier. And do not panic. Once again, if you have any of the symptoms, consult an ENT surgeon immediately, because the early diagnosis is the key for the successful outcomes and to prevent lots and lots of morbidities which is caused by this mucormycosis. We may order you certain nasal endoscopies, certain fungal examination, CT scans, MRIs, some ferritin levels, IL-6 levels, C reactive proteins, etc., whatever. But do not hesitate to get the investigations done, because this is how we are going to protect you. And finally, get a vaccination done. All the vaccines, as I said, are equally potent enough, and please go ahead and get the vaccinations.